we are back at Orthopaedic Associates in the rehabilitation department. We're going to be talking about knees this morning. Here we have a right knee. It is in the full extension position on a flat surface, and we're going to talk about some basic knee exercises that everyone will probably be doing after knee surgery. The first thing we're going to look at is the ability of you to squeeze your quadricep muscle and engage your kneecap and slide it back. Okay? This is the basic exercise for any sort of knee rehab, and it's going to be what we call the Quadricep Set exercise. Just an isometric contraction of the quadricep muscle, a group of muscles that sits right on top of the knee, comes over the kneecap, and attaches here at the tibia. Okay, so what we want you to do, Kendra, is press down into the table, point your toes back up to the ceiling, knee down to the table, good, and relax. When she relaxes, you can see the kneecap slid back down, and repeat, good, and relax. 2 more times. And relax. Good. 1 more. Good, and relax. Okay, again, this is called the Quadricep Set exercise. She's squeezing this knee. It's causing these 4 muscles on top of the knee to pull the kneecap up in the correct position and relaxing it down. We're going to look at the straight leg raise. Again, we have a right knee here in full extension on a firm surface. This is always the best place to be if you're at home trying to replicate this maneuver. So what we want you to do is press your knee down into the table. As she locks her knee out with the quadricep set, you'll notice her foot is trying to come up off the table in a little bit of a heel rise. She's dorsiflexing back, so she's toes back, she's knee down. Now you're going to lift the leg in the air. Good, right there, good, hold it there. Notice she's got no bend in her knee. She's going to put it back down on the table, relax it, the kneecap will fall back down into its original position. That's 1. We're going to repeat that 5 times now. And again, lock it first, then lift it, hold it, lower it down, and relax it. That's 2. Always lock it first, then lift it. There's 3. Back down and relax. Hold for me, Kendra, here. Good. Go ahead and lock it down first. Toes back a little bit more. Good. Now lift it, hold it, lower it down, disengage it. We're going to do 1 more time. Again, toes back, knee down, lift it up, hold it, lower it down, and relax. Again, that's the straight leg raise. All right, here we are. We're looking at the right knee again. We're staying with our basic knee exercises. What we're about to do is a knee bending stretch or a knee flexion stretch for the right knee. If you're at home and you want to work on trying to increase the ability to bend your knee or stretch scar tissue in your right knee, one of the easiest things you can do is lie on your bed and just heel slide or bring your foot up in the air to a position in which you feel the stretch on top. When you feel the stretch on top, hold it there 20-30 seconds and let that stretch gently apply over time. If the stretch is unsustainable because the pain is increasing, then we should back the stretch up and hold it in a manner in which it's tolerable. We never want to push above a maybe 3 to 4 out of 10 kind of pain range. Our pain should always be mild to moderate at most. Okay, put the leg down, relax it. Okay, and again, let's do that 1 more time. We're going to bring the knee up, bring it to your tolerance, boom, and hold it. If the foot is in a dorsiflex position, backwards like that, that'll intensify your stretch at home. This is kind of the preferred position for bending the knee. Again, things to look out for are your inability to hold the stretch with pain over 30 to 60 seconds, or obviously if you're post-operative and you have an incision in the front, you would not want to have any sort of problem come from that incision site. All right, now we're looking at the left knee, and we're going to look at ways to help straighten this knee. Oftentimes after knee surgery or after a knee injury, any sort of trauma, you can lose your ability to straighten this knee due to tightness behind the knee. So the first thing you want to do is find a flat surface. Get on the flat surface, put your leg out straight. Second thing that you can do is just let gravity itself kind of flatten your knee and feel that stretch. If you need additional pressure besides gravity, you can take your hands, kind of go on top of your knee and give it a force straight down into the table. Again, if your foot is back, if you press your knee down, you'll feel the stretch, and you should feel this behind the knee. If you need the stress to be in the hamstring, a little bit higher in the muscle, then we can lean into it by going chest up tall. Good. Bring that chest out, shoulder blades back. Good. Now lean into it. Notice you should probably be feeling it back there. Good. Again, if you're feeling the muscle stretch or a stretch behind your knee, we want to hold it 30 seconds, 60 seconds, gently over time. We're going to be looking at now stretching the top of the thigh here, the quadricep muscle, and the hip flexors. So one easy way to do this at home, if you can't lie on your stomach and bring your heel towards your buttocks in a traditional kind of quadriceps fashion, we can hang the leg off the side of this table, and at home you can hang it off the side of your bed or sofa is a common area. And as you can see here, we are now elongating the front of her thigh from the hip to the knee. If this stretch you are unable to feel it, all you have to do is slide your foot backwards underneath you, and then you'll intensify the stretch up top. Again, if you feel the stretch, it should be tolerable. We want to hold it 20 to 30 to 60 seconds and repeat 2 to 3 times. Looking at different ways we can stretch behind the leg. Earlier we went over a hamstring stretch, pressing down on your knee, leaning forward. Here's an alternative, using a strap lying on your back. We can use the strap around your foot to lift your leg straight in the air with your arms. Okay, so what you're going to do is put the strap down, pull with your hands, find the pull behind your leg, and hold. 20 to 30 seconds, 60 seconds if you can. Okay, and then we'll call that 60 seconds there. We'll put it down, and then we'll repeat one more time. Go ahead and pull it up. Use your hands. Your hands should be doing the work. Your leg should be completely relaxed, and your knee should be straight. So we're elongating everything behind the leg here. Now, if we want to make a modification, we can try and stretch the lateral hamstring muscle out here by letting the leg go across your body, away this way, and she should be feeling it on this side of her hip. This is a very common stretch that we like to do for hip bursitis, or if we want to stretch the outside part of the hamstring, IT band, trying to affect the kneecap. Bending stretching. Here we've got a strap. We can do an assisted knee bending stretch by putting the strap around her foot, using your arms to help pull the foot up in a heel slide maneuver. Find a comfortable position for the amount of tension you want to put on the top of your knee and hold it 20, 30, 60 seconds. Good. So this is what a lot of people will call a towel heel slide stretch, or a strap heel slide stretch, where you can just slide your foot up on the surface that you're on, find the position that feels comfortable to you, and hold. Just trying to work on bending this knee or getting your heel closer towards your buttocks.